So this video is to tell you about my experience with the cubital tunnel syndrome correction surgery. It involves the ulnar nerve, which runs from the spine around down the shoulder, or down the neck and down the shoulder, around the back of the arm, down through what we often call the funny bone, and it's through the cubital tunnel, and then comes up through the arm this away, and then onto the palm and across and to the thumb. It mostly affects the pinky finger and half of the ring finger, although it does have some function in the strength of the entire hand, which was my problem. I had had a problem with my hand, weakness, lack of control. Since I'm a musician, that was kind of a big deal. And so I play bass regularly, and I actually have had no problem playing bass, even with the limitation. But when I try to play guitar, forming the chord shapes was difficult. So it was crazy, and I kind of caught on late. I realized I was basically atrophying my hand. It's hard, maybe you may not be able to tell, but in here, this muscle on the right hand, my right hand, is very, my hands are fairly strong. I've played music and done a lot of mechanical work in my life. This one here just lost a lot of muscle in there, and really that control the fingers. So I was pretty concerned. Talked to the doctor. They gave me the electrical test, gave me the electrocution treatment, which determined that, they put electrodes in, they put some needles in your different parts of your hand and all that. But anyway, long story short, they determined that my problem was in the elbow, in that area there. Um, so I was scheduled, and often you can get this corrected without surgery by just doing a lot of therapy and stuff, but mine was pretty far gone, so I needed to have the surgery to correct it, to make sure it didn't get any worse. So I can live with it if it doesn't get any worse, but I really don't want it to deteriorate further. So my procedure, I'll tell you what it was not. It was really just the cubital tunnel syndrome release. It was not another one called the ulnar nerve transposition. There's another procedure where they can move the nerve out of this little pocket here between bones and over to somewhere else, and they can do it either on top of the muscle or into the muscle. And so I did not have that done. I just had arthroscopic surgery to correct where my nerve was being bound up in the elbow area. So I had it done yesterday morning as of the recording of this video. So it's been maybe 30, 31 hours since the procedure. So I thought I'd give you the fresh results. So I arrived a couple hours before the procedure, which is what I was directed to do. The procedure was scheduled for 7 a.m. I arrived. They actually were a little easy on me. They made me arrive at 5:15 a.m., not 5 a.m. Was required to have a designated driver, so I brought along my wife, dragged her out of bed early, and we went there, arrived, checked in. They confirmed, of course, my name, birth date, insurance coverage, and we waited in the waiting room. We were called pretty promptly because I was first in line that day. And so we were taken to the prep room where, again, my name and birth date was confirmed. As you know, medical world, they're careful with that to make sure they're not doing, taking out my appendix instead of correcting the ulnar nerve problem. So again, they did that, and then I was given this crazy paper gown to put on that was connected with weird Velcro-like stuff. But anyway, told to take everything else off and just put that on. But before that, they gave me a packet that had like a half a dozen wipes. They were pretty big, and they wanted me to completely wipe myself from the neck down everywhere. I needed help, so they brought my wife in to help me with that, to get like my back in areas I couldn't reach. And so that was a little crazy, but they said that they had done an informal study which proved that it helped prevent infection. So hey, whatever, right? So we did it. I put on the silly paper gown, got into the gurney, sitting up or leaning back a little bit, kind of sitting. They then started an IV in the hand that wasn't going to be affected. It was going to be done on my left. And so they put it in the IV in my right hand, got me set, gave me something that, some kind of medication they said basically would make it so I didn't really care what else they did to me after that. and it gave me a little relaxation. And I didn't notice a whole lot, but I'm a little resistant to drugs myself, but I guess it relaxed me. Then they brought in the anesthesiologist, who was an MD. She explained what she was going to do. She was going to put a nerve block, I guess, go into my shoulder or neck area. Not sure which. To hit the same nerve, but upwind, upstream of where the doctor was going to be working. And so while she was talking to me, I guess maybe the stuff that went into my IV kicked in because things got a little fuzzy after that. I don't remember a whole lot of what she said. I know she said she was going to do it. I did see her threatening me with this humongous needle and a pretty big canister of something, some kind of liquid. And so um, next thing I knew, I was in the room with my eyes closed and I heard people talking. Actually, it was another room. And so I was kind of lazy, didn't feel like opening my eyes, but eventually I opened my eyes and looked around and was talking to people. Fortunately, I think the medication that put me out was propofol, of course, the Michael Jackson drug, which is wonderful. That stuff is great. You wake up from that feeling just like you had a nice nap. So they basically let me get dressed again, and when we were finished up, I was bundled up. My left arm, which had had the procedure, was bundled up at the time with an ace bandage, looked like an ace bandage. And of course, it had the padding over the scar. I'm trying to keep the scar away from the camera because I want to give you some warning in case you're a person who gets squeamish about seeing things like that. But I got my railroad tracks. I'll show you, but I'll give you fair warning near to the end of the video. So I went home. My wife, of course, drove me home because I wasn't allowed, and they thought I was impaired or something. Who knows, right? But I just, I was told to just goof off the rest of the day, and I'm very good at doing that. So I did that, and we watched TV together, and I didn't have a whole great appetite, so I mostly drank water and stuff, and so just relaxed. And then the next morning, my care team, the information they gave me advised me that I was allowed to take off the bandage and the dressings and everything, and I was allowed to have a shower, which was great. They said, of course, not to scrub that area, but to just maybe let the water run on it. So I was able to work around it with the washcloth and just clean up whatever I could. And the craziest thing about the day of the procedure, this left arm was entirely numb and useless. I not only couldn't feel anything, I could have stuck a needle through my hand and I wouldn't have known. But I not only could not feel anything, but I also could not tell it to do anything. I would tell it to squeeze with my mind and feel like it was maybe doing it, but it didn't move. It was crazy, and it was dead weight. It's kind of amazing how heavy an arm is when you have to pick it up with your other hand just to get it. Oh, I was in a sling as well. I forgot to mention, but I would kind of readjust the sling, and they had a lot of ice on it, and so I needed to put ice on it, continue to keep ice on the wound area, even through the ace bandage and everything, 20 on and 20 off, which I pretty much did pretty carefully. I don't know how much of the cold really got through that. It was kind of thick, the bundling, that they had put over it, but that's to reduce inflammation. They also had given me medications to come home with. In my case, it was meloxicam, which is apparently a NSAID, and the other one here was hydrocodone and acetaminophen. And so they warned me, don't let the pain catch on to you where you have to chase it. They said, stay ahead of it. So I think I took an acetaminophen hydrocodone maybe 6 hours or maybe dinner time, after the procedure, just to do it, even though I wasn't in any pain because my doggone arm was numb. And so, that relaxed me further. And then I really didn't take anything else after that. I thought I kind of felt, while my arm was numb, I thought I kind of felt where the incision had been done, but, it didn't really bother me at all. And honestly, one thought crossed my mind: did that anesthesiologist maybe make a mistake, and maybe she gave me too much, and or maybe my hand will never come back, my feeling will never come back, and I'll never play music again. But eventually, probably about 10:30 or 11 p.m. that night, I started to feel a little bit of tingling in my hand, and then the feeling came back in the rest of my hand, but my pinky and half of this finger were still numb. I mean, which makes sense because that's the nerve that controls them. And then before I went to bed, I probably went to bed at midnight, and it started to get that way. It was getting better. I could actually hold some things, but I wouldn't have wanted to trust myself with liquid or anything in that hand because I don't know if I had the grip. I know I didn't have the grip to handle it, and so I went to bed. Woke up this morning, and because as of this, did I tell you, as of this recording, I had the procedure yesterday, so it would have been 30 or 31 hours ago that the procedure was done. Woke up this morning, had full feeling in my hand, full function, and it was I could lift my arm by myself without having to lift it with the other hand. So that was really great, and I honestly hardly have any pain. I mean, I may be a tough one to tell you this because everybody's different, and I tend to be pretty resistant to pain. I'm the guy that gets crown preps done by my dentist without any Novocaine or anything, just because I'd rather go through a few nerve zingers and then not have to drool on myself the rest of the day. So I know not everybody's going to have this response, but I really don't have hardly any pain. I'm very grateful. This morning, what I was really interested in was if I can play my instrument. So I picked up my bass guitar. I actually played it. It's okay, pretty good, because I have a gig in 5 days from now. So um, I tend to be there and play. The limitations I was given were just that while you have the stitches in, don't lift anything heavier than maybe a coffee mug or something like that. You don't want to bust the stitches out, and you're not supposed to flex bend your elbow tighter than a 90. So, which I've disobeyed regularly, but it's feeling pretty good. And so, anyway, I will now show you the incision. Give you fair warning in case you're squeamish. You might want to fast forward, skip past this. We're nearly at the end anyhow, but I'll let you know what it looks like, show you my railroad tracks, and here's your fair warning. 5, 4, 3, 2, 1. Now, here you go. This is what it looks like. It was a little bigger than I expected. I believe I kind of expected maybe a half inch, well, three-quarters of an inch, maybe an inch at the most. It's about 2 3/8 of an inch. I sort of try to measure it. You can see the surgeon's artwork on there still too. I didn't get it all washed off, but they like to draw lines on you where they're going to stick the scalpel and stuff. So anyway, this is what it looks like. It really doesn't hurt. If I bump it accidentally, I bumped it a little bit accidentally, and that was a little bit uncomfortable, but I'm really doing well. I'm grateful. And the procedure apparently was a success. The surgeon told my wife, I actually never saw the surgeon the whole day. He talked to my wife probably because he thought that I wouldn't remember anything he told me. So he explained to her that my problem was pretty severe in that the nerve was thinner from here up to the hand than it should be. I've watched surgeries on YouTube, the procedure. I was kind of curious, morbidly curious to see what it really looks like. And that nerve bundle is pretty thick. It looked to me like it's maybe an eighth of an inch thick. So the surgeon told my wife that it's thinner than it should be, where it crosses my forearm and everything. And so I'm really hoping that grows back. I know that it's not going to happen very quickly. It may take a year, 2 years. I don't even know. And so I'm hoping that will grow back and become as thick as it was before. Don't know if that's the case. I think what basically has happened is that the surgery has prevented further damage. So anyway, I have no illusions, that it's going to be great, and I'm going to be, doing everything with this hand. But it's working well enough to do what I do with the music, and so I'm grateful for that. I hope this has been helpful. And if you plan to have the surgery, I hope yours goes well. And if it goes as well as mine, you'll be doing great.